Welcome to Sold on Local with Lori Seavey and Karen Shores of the Lori Seavey Realty team. And today we're really excited to be here at PhysioHealth Physical Therapy, located at 560 Kelly Boulevard, Suite 2 in North Attleboro.
PhysioHealth Physical Therapy provides clients with innovative solutions for rehabilitation, pain management, and wellness services. They are committed to being the industry leader in physical health and wellness. They focus on providing expert-level healthcare that exceeds expectations and empowers clients to be in their best physical health for the activities they enjoy. We're here today to speak with the owner, Chris Gomes.
All right, Chris, we are really excited to be here today in your beautiful clinic here in North Attleboro. We get to talk to you about your business. We know that physical therapy is something that is super important and a lot of people are needing it. Earlier we were talking about Karen's needing it for her shoulder. I'm needing some for my hip right now. So we're excited to bring your business to the community. So I'd love to ask you some questions. How did you even get started in wanting to be a physical therapist?
Yeah, thank you, Lori and Karen, for having me. So when I finished up with physical therapy school back in 2012 and got into the field, I was just initially thinking that, well, let me become a clinician. You know, I'm going to work for a private outpatient clinic. After that, it changed to let me try the inpatient world. And as time kind of went on, I started to realize, you know, I provided a good service to the public. I was interested in understanding the business world, and I wanted to put together a product for people and that have that product, you know, impact a large number of people. And so my goal, you know, by growing PhysioHealth Physical Therapy is to take care of, you know, the community, help people live a healthier and happier life. And then as time goes on, bring on staff and implement that strategy and implement that type of, that culture, and then expand PhysioHealth.
Right, so that's why you wanted to open up your own office.
100%.
Yes, which is great. Like I said, we definitely need that. So what conditions do you treat here?
Yeah, so in outpatient physical therapy, we see a lot of things. So we see a lot of people who have some joint pain, or they're finished up with surgery and they need post-surgical rehab. So anywhere from people having pain to post-surgical rehab to sports injuries. We focus on getting people, you know, from where they are when they're dealing with like an injury or any type of pain to back to their prior level of function. So whether that's working on their balance, whether that's working on their strength, whether that's working on range of motion, there's, you know, the traditional physical therapy model that we work with people in here, but we also work on adding in some new services that are innovative in the field, such as laser therapy, shockwave physical therapy, air compression therapy, and we're really trying to grow the brand to take the modern approach to healthcare, bring it to the public in North Attleboro, and grow from there.
Right.
That's great. I'm sure you've had some really rewarding experiences helping patients. Can you tell us a little bit about maybe a more challenging patient or a situation where then you were able to help them achieve their health goals?
Yeah, Karen. The thing that I take most pride in is that kind of second opinion. Somebody's been dealing with physical therapy for a while, they've been in the medical system for a while, and they haven't quite got the solution that they needed. And sometimes people come in here with one diagnosis, and one of the terms that we focus on in medicine is a differential diagnosis or the second opinion. And sometimes people are chasing the wrong issue. And in physical therapy, with my history and background, you know, being in inpatient care and outpatient care over the course of the past decade or so, I've really kind of saw different parts of the system, different types of conditions that people dealt with over the course of time, from being in a hospital setting, from being in rehab, from being on the sports field. And when you understand the person from that level, you can understand exactly what they need and what other past patients have dealt with. So I really focus on taking somebody who might have been dealing with that challenging condition that I haven't quite recovered from, and then properly evaluating them and giving them that correct diagnosis. So one person I'm thinking of is somebody that was doing physical therapy for a couple of years. They had been diagnosed with back pain, and just from the day that they walked in, they were limping with an odd type of gait, and it seemed naturally more hip issue, hip arthritis, and something was funky there. And after a session or two, I was like, hey, you might want to take a look at this. And as time went on, it was hard to get their buy-in because it's something that their physician was telling them that it was like their back. It was a prior PT that was telling them that it was their back. And I was just like, we can kind of kick the can down the road a bit, but like you really got to go get this hip checked out. Turned out, there was like some ongoing issues there, and he ended up getting a hip replacement. And it took him a while to build the strength back up, but over the course of time, making those like simple steps, it kind of grew to that future of like him kind of approaching to where his baseline should be.
Wow. Right. And you probably saved him a ton of time because I went through the same thing where they were focused on my back somewhere else, and it wasn't my back at all. It was my hip. And I wish I had known that probably a year earlier. So that's awesome that they came to you and you were able to point that out.
Yeah, so like in businesses, something like standard operating procedures, so we like to automate things, and there's like things that you see and you're like, okay, what's the next step? What's the next step? My philosophy is that I don't like the standard operating procedure because everybody kind of presents differently. So if you have the conversation with the person and you listen to their story and you listen to where they're coming from, you'll pick up on things that like the general system isn't picking up on. So like when you hear like the path that they've been on, you hear their individual complaints, you know what they exactly might need. So the answer might not be twice a week of physical therapy for 6 weeks. It might be one time a week for 3 weeks spread out over the course of the month. So it's not always the same formula. So when you kind of take that individual approach to that person, you can help them kind of speed along the process, but also avoid just like unnecessary medical bills, surprise billing at the end, like, oh, I thought I was coming for 8 visits and it's, and I only needed 3,
Yeah, right. Wow. Yep.
So you mentioned earlier, and I know we talked about some of the new technology that you have. Tell us a little bit about some of the new innovations and things that you're helping.
Yeah, so like when people traditionally think about physical therapy, they're thinking like, oh, I need strength or range of motion, and if it's not strength or range of motion, that's it. Well, there's some other technology that's like really come out in the bio world where people are starting to use more laser therapy and the shockwave therapy. So laser therapy is a machine that uses like a focus beam that helps with improving blood flow on a certain area of tissue, whether it's like a damaged tendon or like a muscle that's in spasm, or just a general area of like a trigger point where there's a source of inflammation. So what that beam does is it helps to focus on improving the blood flow, and by doing that, you're essentially kicking on the natural like healing process of the body. So it helps to eliminate pain in anywhere from like 1 to 3 visits. So it might not be the specific answer, but it's like one of those like steps you have to take to get to the next level. And then the other product that we brought in here is the shockwave therapy. So the shockwave therapy is almost like an agitator tool that will like use vibration to help to bring on the natural healing process of the body. So you'll have somebody that comes in with like shoulder pain or like a sprain or like tendonitis in their shoulder, and we'll just put the shockwave tool on there, and it'll just like work its magic for like 3 to 4 minutes. It'll be done, and it might be 3 to 5 sessions, and that'll be that next step to kind of get things further along.
Okay, maybe they should name that vibration therapy.
Yeah, no, 100%.
It's like that one. And then you were talking about fascia too, because that helps, and that's a huge word that's out there right now. Everybody wants that fascia healing or whatever it is.
Yeah, so fascia is like tissue that kind of underlays the muscle and then attaches to the bone of the body, and it forms almost a connective tissue. So what you have to do is depending on what type of injury the person has, whether somebody's like dealing with like stiffness or post-surgical rehab, sometimes like the muscle not moving for a long period of time will kind of like cause it to kind of get stuck, and then that stiff muscle then kind of sits on top of that bone, and then the tissue between the two isn't moving. So what we'll use in here is either deep tissue massage, or we'll use like a Graston tool to help to facilitate that movement of the body, and that'll help to restore range of motion. So for example, if somebody comes in with frozen shoulder, the joint's stiff and they don't have range of motion, but it's not as simple as just kind of like ranging and stretching out the shoulder. Sometimes you have to kind of look at those individual components and then kind of like work through the range. So you're first like working on pain control, and then you're working on the myofascial release. So you break up that fascia, and then breaking up that fascia, might get them like a few, like 10, 15 more degrees, and then that'll kind of facilitate more of like a home stretching program. That's kind of like where the segmental steps kind of take into effect. Yeah.
And the fascia and all that you do with there, that's all covered with insurance?
Yeah. So like physical therapy is like a service that addresses the fascia. So we'll use tools in here that are covered by insurance that address the patient, but we also have a lot of the services in here that are cash-based, that aren't covered in insurance. So depending on kind of what somebody needs, the physical therapy can be like a good avenue to kind of get in here, work on the range of motion, work on the fascia, and kind of get them to like what they need to do for their baseline.
That's big, because I know I went to somebody to help with fascia totally separately. It was all out of pocket.
Yeah.
So you don't have to do that. You can come here and get that taken care of.
Yeah, so we strategically designed the system in here so that the front desk exactly knows how the insurance world works. The therapists know how the insurance world works, and we try to minimize the out-of-pocket costs for the patient.
Okay.
So like we try to take care of the patient first.
Okay, because I was going to ask you that about insurance. On how to walk people through. It can be confusing and all of that, but
overwhelming.
But you're great at that part, walking people through that.
From like year to year, benefits change within companies because the decision makers within the employers are kind of like picking apart like what they want to cover in their plans, what they don't want to cover, and every single year with like the front office, there's this like ongoing battle to kind of figure out like, okay, what's the deductible, what's the new guidelines. Does this person need authorization? Does this person need a referral? And it's complicated for the patient. So the simple answer for us is just give the office a call. We'll take care of all the back end stuff. We'll let you know if you need to do anything, and then we'll book the appointment to take care of you. But from the insurance world, it's just we do our best to communicate like openly with the patient to like avoid any type of like surprise billing or any type of like uncovered service.
Perfect.
That's great.
Yeah.
So Chris, tell us a little bit about how community involvement impacts what you do here at the clinic.
Yeah, so what we try to do is like right we're a physical therapy office. We're local to North Attleboro. We treat people from surrounding areas like Foxborough, Mansfield, Attleboro, Seekonk, Rehoboth. And what we just want to do is we provide our business like in North Attleboro in terms of like providing physical therapy services here. But when it comes to doing events outside these four walls, like we focus on, trying to go to road races, helping people out with like building a healthier community. We try to do seminars in the community. We try to reach out to different businesses to support each other. And so, when it all kind of comes together, like we're all trying to help each other, achieve that next goal. So like with the business product of like physical therapy and trying to do something that's like different, we try to like elevate the status of not only what we're doing in here, but we try to get people to achieve their goals. We celebrate the achievements and we try to get people to that next level.
Mm-hmm. That's so great.
I love that. Well, you got two new patients, and
I was going to say we're both going to be booking.
We're both calling our doctors coming through.
Oh yeah,
we are. Yes,
that's awesome.
Yes,
we happy to have you.
Well, thank you so much for having us today, and we've loved learning about all that you offer, and we definitely will be making appointments. So.
Yeah, thank you, Lori, and thank you, Karen. Yeah, it's been great, and it's been a great interview. Thank you.
Perfect.
Thank you. And thank you, everyone, for watching this episode of Sold on Local. We'll be back with another local business next time.